Coming up today, tiny patients with big medical needs. But what do babies need after the NICU? See how one program is adding a little simplicity to the very complex care that many children need. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Babies in the NICU get round-the-clock critical care. And once they're healthy enough to go home, they still deserve high-level care, often from more than one specialist, which is why 11 years ago, a nurse here at the University of Kansas Health System helped create the nation's very first neonatal medical home.
I've been a neonatal ICU nurse for over 25 years, and what's really important to me is to see that these patients are not just ready for discharge, but that they're actually have the most optimal outcome that we can provide to them by the time they're going to school. So where most neonatal ICU graduates are followed by a primary care doctor, we feel that it's so important that our commitment to this patient doesn't end at the time of their discharge, but really that just begins a new stage of their following with KU, and that is in our neonatal medical home.
Since its start in 2013, the Neonatal Medical Home has helped thousands of kids and their parents. Today, we are meeting one of those parents raising a daughter with a ultra-rare genetic condition, and we're going to hear how much work it took just to make sure that she was ready for preschool. But before we meet that mom, let's go inside the Neonatal Medical Home with baby Kinley and her parents.
I didn't get to hold her until she was 1 week old, and then that was with tubes taped to me, and her little bottom didn't even feel my palm of my hand. Now she makes my arms tired holding her, so that's a good feeling.
The greatest part, I think, at this point is just seeing her today, just seeing how healthy she is and the obstacles that she's overcome.
She looks like a healthy little girl that has never been in the NICU. She started out really with a tough challenge, but now if you look at her, you wouldn't even be able to tell that she was on oxygen. She was on all these medications for her lungs, and she actually has been pretty healthy since she left the NICU.
Can you just show off for me? Hi, there you are. That's a good way.
For us here at the medical home, we try to give them everything that they need and try to bring in the subspecialist so that, again, these parents don't have to go to 4 different appointments just to address a very complex disease that actually has a lot of aspects to it.
We're going to do the echocardiogram. We're going to look at her heart.
It allows us to talk to each other and kind of come up with one plan instead of kind of 2 different conflicting plans depending on who saw her. We make it fun for the patients because it's very stressful to come back to a hospital where you've been living in for several months. It's a pleasure for us to always see our patients back and see how well they're doing, because it tells us that what we did while she was in the NICU was the right thing to do for her or for them. And so that's always kind of a mixed, like, professional visit, but also a play.
Look at this! If you like being upright, this might be the thing.
It's kind of a reward, a little reward for us too.
We're off of the oxygen first, and then she's there. At night too? At night.
Yeah.
Wonderful. She'll have her echo come.
It didn't bother me. The appointments might be 3 hours long, but by the time we see everybody, and it's just nice to have a one-stop shop for sure.
Yeah, it'd be much more disruptive to her schedule to try to hit 3 or 4 appointments a week at different locations. So.
Hi there.
Hi.
How are you guys?
Good. How you doing? Good. The duration of this appointment isn't that bad in comparison to having to get her out 3 or 4 times a week, because, like Lisa said, when she got home, she was hooked up to oxygen, 2 different monitors. She wasn't very mobile, even around the house, let alone loading her up and getting her places. And it was still cold outside too, so with her lung disorder, that was always a concern of how much outside air she was introduced to, or common places that she went.
Our exams monitor to make sure that their retinal blood vessels grow normally as they continue to grow, and but these exams aren't fun for them, they're necessary.
She came at 25 weeks one day, and she was 1.9 pounds. Just to sort of see her almost 10 pounds a day she's just our miracle. That's the name I give her all the time. So she's our feisty miracle.
She's a fighter. That's how I describe her. She's got a lot of her mom in her.
Today we are hearing also from Izzy Duval, whose daughter was born early, weighing just 4 pounds, and she admits the first nights in the NICU were traumatic.
During that first night, they came to us, one of the doctors, and basically said, we never expected this, but we took her down for a CT, and not only did she have, like major swelling, but that's when they found the skull fracture. We hope she'll be okay, but they kind of said like some kids don't come back from this.
Dallas was later diagnosed with a rare neurological disorder, but after years of treatment and therapy, Dallas is now accomplishing things that her parents weren't sure that they would ever see.
It's awesome to be able to come home and then she yells, "Daddy," when in the beginning I didn't know if that was ever going to happen. So yeah, it's a whole new world getting to communicate and talk to her.
And we are so happy to be speaking this morning with Dallas's mom, Izzy Duval. How are you doing, and how is your daughter?
I'm doing well. I'm getting all teary from looking at that.
I bet.
Remembering all the memories. But we're doing well, and Dallas is having a good week. When she's good, and when she's having a hard time, then all hands are on deck. But she's doing well this week.
Well, as Dad said, she's got a lot of you in her, so I like to hear that. Here in studio with us, we are joined by two nurses working inside our neonatal medical home, clinical nurse coordinator Rachel Brown and clinic nurse Emily Fritsch. We are glad to highlight some of your work as we celebrate Nurses Week this week, so good to have you both with us.
Thank you. Thank you.
So Izzy, take us back to when Dallas was born. How long did she spend in the NICU, and what type of care was she getting?
Yeah, so when she was born, we knew she was going to be small. We knew that she was growth restricted, but we didn't know that she would have the kind of traumatic birth that she had. That was a really difficult birth, and she suffered a brain bleed. And so when she was born, that she was essentially whisked right away to the NICU. And we didn't know what to expect, first-time parents, so it was very, very scary. Thankfully, my sister is a nurse, and she was there, and she was able to go with my husband, Matt, into the NICU to see Dallas. And I think that's where these first pictures that you're looking at come from, is when they first got to visit her, and they Skyped her into me. We ended up being in the NICU for about 2 weeks, and the first about 48 hours were definitely the worst, because that's when they were treating the brain bleed and the skull fracture, and it was a subgaleal hemorrhage, so it was like a really scary situation with like internal bleeding essentially. And that's when the doctors told us, we hope that she'll come back from this, but we're not sure. So that was definitely the most traumatic time. But once we got past that, and we were into like maybe day 5 or so, then they were just treating her like a regular preemie NICU kid, and focusing on, feeding and growing and breathing on her own and all of that. But yeah, it was definitely traumatic at the start.
Oh, I have just watching those milestones, and full disclosure, I was a level 3 NICU mom myself, so I get you. We'll have to talk, because I know what that's like. You think this is not exactly the experience I expected to have, so I'm with you.
Yeah.
You finally leave the NICU after 2 weeks, I think is what you said?
Mm-hmm.
The longest 2 weeks of your life. How did you end up finding the Neonatal Medical Home?
Yeah, so when we were finishing up our time at the NICU, I believe Dr. Pandy recommended that we would follow up with the Neonatal Medical Home. She was still having some like rebounding jaundice at the time, and they just wanted to check on that. And at the time, we had no idea about her having complex medical issues past the NICU. We just thought it was just the birth. And so we were really fortunate that we ended up getting a referral to see Robert Fenton, who's been our PCP ever since, in the Neonatal Medical Home. And then we just stayed with them from then on. We just decided that it was, at the time we lived in Lawrence, and we decided that it was worth the drive to come in and be able to meet with providers who, knew her history. And I believe they have like meetings with the NICU doctors and the Neonatal Medical Home to get everyone on the same page. So it was really fortuitous for us to end up there.
Yeah, it's like this big, just like everybody kind of wrapping their arms around you, and just that peace of mind knowing that everybody's on the same page, kind of this one-stop shop, but knowing that, you're not running around town to these appointments that are difficult as they are. And we mentioned that she was diagnosed with a rare condition, something called AHC. What is that?
Yeah, so as she got older, about around the age of 1 is when we started seeing like the really severe manifestations of AHC. So AHC stands for alternating hemiplegia of childhood. It's a bit misleading because it's not actually just a childhood disease. It will last lifelong, and it's an ultra rare condition, so meaning that the kids who have this are considered 1 in a million. I believe there are less than 1,000 cases worldwide. It's a condition that happens from a change in the ATP1A3 gene. And so we didn't know that she had this gene change. And what it does is it kind of messes up the potassium pump. I'm not a scientist, so I can't really tell you what all that means. But what it does in the kids is they start to have these, what they call episodes. And the episodes consist of just about any neurological symptom you could have. Primarily, it's going to be like full body paralysis or partial hemiplegia. So they stop being able to walk and talk and use their bodies. And then they also have abnormal eye movements. So I think you guys probably have seen a bit of the footage of Dallas's eyes. At one hospitalization, they were locked straight upwards, and we've seen nystagmus and other eye things from time to time. And then also dystonia, which is really painful muscle spasms. And so all of those things put together, it seems it's similar to a seizure disorder. However, seizures generally are able to be ended within minutes to, an hour or so. And these episodes actually last for hours to days and sometimes weeks. And so it was very, very scary. But, we were grateful to get her a diagnosis and start to get her treated.
So these would last, you said, days and weeks, where she would be in the state that we're seeing right here. What would your interaction with her be? What would the care be like during this time span?
Yes. Yeah, so you can see she's in the hospital in this video. This was from her first severe episode. It happened in 2019. We had been very protective of her post the NICU, and she'd only gotten sick once, which did require hospitalization. But this was just different. She started to vomit and was obviously in pain and not feeling good. And then her whole body became weak, and she was having what I called floppy head. I didn't know, I'm like, okay, this is sick, but what is going on here when her head just couldn't lift her head anymore? And so I called my sister, because at the time we didn't have good insurance, and was like, do you need to go to the hospital? What do you think? And she was like, yes, you need to go. And so we went, and then, the dystonia. So it can last, all those days. It's really scary, painful for the children, and unfortunately there isn't a cure at this point for AHC. We can treat it, but many times we will end up in the hospital, as you can see from that clip. Now, fortunately, Dallas has a G-tube, and so we're able to provide nutrition and hydration and medicine through that tube, because part of the body becoming paralyzed is that many of the even organs stop working. So the gut shuts down, and oftentimes Dallas can't swallow when she's in an episode. So sometimes they can communicate with us if it's a milder episode, sometimes they can't. And it's pretty much just always a terrifying experience, because you kind of feel like you've lost your child for a few days. And then the craziest thing is that they come back from it. So they lose all these skills, they're in terrible pain and having seizures and things like this. And then, either the episode relents or you give a medication and they come back, and then you see your child again. So it's a very strange experience. It's very scary. But yeah, many times we do end up hospitalized from it.
So Izzy, I'm going to bring in our nurses right now, and I love watching and listening to an articulate mother who's done her research, and she kind of gets this pseudo medical background, because when it comes to your kid, you did a very good job, Izzy, by the way. Just your stuff. Nobody knows their stuff more than a kid's parent. So Rachel, just help us understand the model of the neonatal medical home. What is that? What is the idea behind that?
Yeah, so we're designated as a medical home. Some clinics receive that designation. It's basically a fancy term for saying we're going to provide comprehensive care throughout multiple disciplines. So you're not just going to a primary care physician, you're also seeing someone who specializes in prematurity and NICU follow-up, whereas a lot of other locations you would have to see 2 providers for that.
It's a very specified care, and you just touched on it, but what would the alternative be for someone who's not with you?
Most kids in the area would have a primary care physician wherever they choose, and then they would see a NICU follow-up provider, typically at Children's Mercy. And then we also have the ability to have occupational, speech, and physical therapy come to clinic to do evaluations. We have the registered dietitian, lactation. Everyone can come to our clinic to see them. So it's just kind of like a one-stop shop for our
Do you
patients.
see like the feeling in a parent when they know, oh, okay, all in one, under one roof?
Yes.
It's the power of something like that. Something you don't realize how important that is when you're dealing with your kid.
And also, like, a lot of people aren't from the metro area and they're coming from further away. So instead of having to go multiple locations, you know, for multiple appointments, they're coming just to us and they're getting it all in one.
So Emily, are you working with one provider in the home?
So we have 2 providers in clinic. We have our nurse practitioner, Robert Fenton. He's our full-time provider, and then we also have a part-time physician, Dr. Shastri, and they're both just wonderful, and they both care for their patients so well.
And what's the meaning behind the word a medical home?
It's just basically comprehensive care. So you're kind of coming in and you're getting everything you need in one spot instead of just, you know, being referred out to different places, going to all these different appointments. We're able to do it all in one place.
It's kind of a cozy way of saying that. Kind of like welcome home, because this is where you're going to be spending a lot of time. But it's kind of like a family environment. So, Izzy, I want to bring you back in because Dallas had some trouble walking, as I understand, and you shared some clips of her learning to walk over the years. What were some of those big milestones as she learned to walk?
Yeah, so, you know, part of AHC is just a developmental delay. And, you know, we were just seeing that she was progressing a bit slower than her peers were. Her muscles just fatigued harder. And I think by around the age of 2, you know, Robert had just kind of watched it with us, had been checking on her. And then I think we decided at that point it was time for her to start physical therapy. So she started physical therapy at 2. And then you can also see that she starts getting, they call them SMOs. They're like little inserts into the shoes that go just up to the ankle, and those have been really integral too. They're from like you go and see an orthotist, and so we, you know, did all that stuff and then just got her into lots and lots of therapy and just kept working on her health at the same time, because that's also just a huge piece of it. And then, I think around the age of 2.5, she was able to stand for the first time by herself. And then by 3, she was able to begin to walk with assistance. And by the time that she got to her current preschool where she is now, she was able to walk without needing what we called handholds in her previous IEP. So you can see her here seeing Santa and running in, and she is active and she's happy and she can run and she can jump, and she may still be a little bit slower than her peers, but the fact that she's doing these things is unbelievable. Many kids with her condition aren't as far along as she is, and so we're very grateful.
Yeah, watching a kid run to Santa Claus, that pretty much sums it up. That's a big happy moment, right? So Dallas has needed a lot of EEGs, I understand, before measuring her brain activity. Have those helped doctors understand kind of what's going on in the brain?
Yes, definitely, because when you see many of the symptoms, it looks like an epileptic seizure. So at first we had many EEGs to rule that out, and sometimes the EEGs would show like abnormalities, but so far it hasn't shown true epilepsy, which we're really grateful for. But we've spent many times in the hospital, you know, overnight EEG or a short one, or I believe one of those pictures that you guys just showed was from a 5-day EEG that we had.
So Rachel and Emily, what's it like? What has it been like to work with this family, and what's it like when you watch a patient meet those milestones?
Yeah. I mean, Izzy has always been so great with communicating with us. So I feel like we know her pretty well. We see her pop up on the caller ID. We know it's Dallas. But I mean, all of these patients, we end up getting like such a close relationship with them, being a smaller clinic, seeing them so often, seeing them for so many different things. So it's been really cool watching Dallas, I mean, get older and excel in things that we didn't know she'd be able to excel in.
Because there's a lot of unknowns,
Yeah.
I'm sure, when people show up. What's it been like?
I think if anything, I've been so impressed with Izzy with all of this. I think she's handled it so well as a mom, and she has advocated for her child so much, and she's done so much of her own research that I think that's like really beautiful, and like she just knows her child so well, and she's always her biggest advocate for everything.
So Izzy, what's it like coming and being a part of this program, the Neonatal Medical Home?
Oh my gosh, it's amazing. I don't have like time to tell you all the nice things I would have to say, but it's been amazing. I mean, the fact that it's called a home, like, yes, I would just agree, because from a family perspective, it feels very homey. I mean, Robert and the nurses and everybody there is so kind. They know us. There's pictures of the kids up on the walls. Dallas knows that she can ask for stickers, and she knows that she can sometimes get more stickers if she keeps asking. But yeah, I think the most amazing part is just the fact that they're able to communicate with us so frequently, so quickly. You know, if we have a problem or like just something popping up symptom-wise, I can call and I know I'm going to get in contact with someone that day. And oftentimes I'll even end up on the phone with Robert himself, her PCP, if that's what's needed. And that's just amazing, because there are other clinics that we go to for specialty appointments that it's really, really difficult to track down a provider. And when you have a rare condition like this and there's so much that's unknown, you just really need to be able to get in contact. So we love the Neonatal Medical Home and are so grateful that Dallas can keep going there, and we will keep her there as long as physically possible.
Well, on that note, let's look down the road, Rachel. What happens when a child ages out of this neonatal medical home? Are there similar clinics that you then graduate into?
Yeah, so we typically, it's really important for us to see them at least until the age of 2. That's kind of when a lot of prematurity related issues would resolve. We used to only see kiddos until 5, but we have extended it. We now see them until 10, which we're excited about. And then kids like Dallas, if she were to stay with us until 10, they would go to wherever they want. It could be any primary care, but there are like complex care clinics for pediatric patients, but they're not like NICU specific. And we have some patients from further away that might stay with us until 2, until the provider says, you know, from a developmental standpoint, you're up to date with every other, you know, average child, and then they can just go to whatever primary care.
Different options based on where they're at. Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. We are on the X platform, or you can email the Medical News Network. Information is right there on your screen. Let's get to some questions from our viewers. And Ruth Ellen wants to know, does this program, do they work with patients who may have insurance challenges?
So we operate like the rest of the health system. We accept most insurances. We do have to have them covered. Unfortunately, we can't provide self-pay, but that would just be the same as any other clinic in the health system.
All right. Jeremy has a comment and question for the nurses. I imagine you see people all the time at their most scared moments. Nothing's more scary than when your child is in danger and pain. What do you find yourself telling those parents most frequently? Is there anything that's kind of your go-to standard of, we got you?
I mean, I feel like our patients kind of know when they reach out to us that we do have them. I mean, we are such a small clinic that usually when they call, they're asking for us by name. We know who they are when they call.
Is there a question that people ask a lot? I mean, is there kind of a frequently asked question, you know, when people come in this time of concern?
Honestly, NICU parents in general are a little more anxious than the average, which is expected. So we're used to having all those questions. I feel like we just kind of provide, you know, like reassurance.
You probably know some of the questions that are coming. Yeah, they probably sound very familiar. Izzy, what did you find the most helpful? Any, just for another parent who is going through it or may go through it, what did you find the most helpful and supportive?
Yeah, I mean, the fact that they are the one-stop shop, like, is amazing. We have had, you know, breastfeeding consultants meet us there. We've had, you know, talking through pre-surgery. We've had so many different things. And so I definitely agree with Rachel and Emily, because there is just this certain amount of comfort that comes with being a part of the Neonatal Medical Home and knowing that your kid is known, that their history is known, and that also as a parent that I am considered part of the medical team. That's been so important to us and so helpful to feel like I'm being heard and believed and not dismissed. And that's not always the case in what we've experienced. And so we're really just grateful for the care that we've had at the Neonatal Medical Home. And I think if another parent were to ask, I would say if your kid has the opportunity to go there, then definitely go, because they're amazing and they are so wonderful with Dallas, and it is such a family kind of a feel there. And if you're not someone who is, you know, going to be going to a post-NICU clinic, then I would just say try to find providers that are similar, that you can get a hold of, that know you and that will listen and consider you part of the team.
Well, and that's another question. Do you have to be a graduate of the University of Kansas Health System's NICU, or can you come from anywhere?
So we you can come from anywhere. We've been trying to kind of expand it to other NICUs like in the city. But usually, yes, a NICU graduate, we do follow some siblings of our other patients just to make it easier for families just to have one PCP for everyone. But we do accept like other NICU graduates from other hospitals.
Mark says a huge shout out to all of the workers at the Neonatal Medical Home. Keep up the great work. So he must have had a good moment with you all. What should people expect at their first appointment? What's that like? How long does that take?
Yeah, so the first appointment, it's gonna replicate really any first appointment with your primary care provider. We're gonna check weight, we're gonna talk through any like anxieties the parents are having and just kind of give them a rundown of what to expect. It's really gonna depend on how complex the child is. You know, we have some coming in with feeding tubes, oxygen, monitors, and then we have some that are coming in that were in the NICU but have done relatively well, and we're just wanting to make sure they're gaining weight well.
Last question is just about mental health, such an important arm of healthcare. So do you offer resources like that to the parents? I mean, a lot of these people are postpartum coming in after having a baby. I mean, even on your best day, it can feel really heavy.
Yeah.
How do you recognize that and direct them to the right spot?
We do like the postpartum depression screenings, like most pediatric clinics do. So we do that until they're 6 months. We give that to the mother. But we have great resources. We have Abby, who is our social worker, who comes in and sees a lot of our families and is willing to see any of them that can help with resources like things like Happy Bottoms or Helping Hands, getting them set up with those. And then we also work with Dr. Lassen, who also sees them in the NICU if parents have anxieties or want to speak to someone themselves.
So let's talk about our takeaways. Emily, what do you want people to take away from our conversation today?
I want people to take away that that as a medical home, like we're here for our families. We really try to provide like comprehensive care, and we want it to feel like a family. We want them to like walk in the door and like they know they can relax because we're going to take care of them and we're going to take care of their babies.
What do you want folks to know?
Basically the same thing. That our patients, I feel like we have such a great opportunity to get to know people being a smaller clinic, that like I want them to know that when they call us, we know who they are, we're willing to help, we're willing to go the extra mile. We do a lot of stuff that I think other nurses don't, just to help them get things coordinated with their medical care. So they're always welcome to ask us any questions. We're always there for everything.
So Izzy, wrap us up. What's the big takeaway from your family's story?
I think that the Neonatal Medical Home has been an unbelievable aspect of it. You know, the nurses are so right. They do go above and beyond and help so much. You know, they've set us up recently with Abby, the social worker, and she's helped get us a grant for a couple different medical supplies that weren't covered by insurance. And I've taken those mother screenings and I've talked to the social worker because, of course, mental health is so key. But I guess for my takeaway, I would just say always advocate for your child, especially if they're rare and complex. And if you can find a team like we found at Neonatal Medical Home, then definitely stick with them long term because they're an unbelievable resource for us.
All the best to you, Izzy, and your family. Thank you for sharing your story. Thanks to all of our guests today and to our viewers for being with us. We'll see you back here tomorrow. Nurses share some of the most complex wounds, infections, and pain for patients here at the health system. On the next Open Mics with Dr. Stites, these extraordinary nurses and nurse practitioners share their expert advice that we can all learn from as we celebrate Nurses Week, Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.